Good afternoon to Dr. Zul and my friends. Today, our group will be presenting our research article presentations on the clinical informatics solution in COVID-19 pandemic scoping literature review. My name is Nicholas. I will be accompanied by Leslie and Dinie for today's presentation. Now, the title of this presentation will be on the clinical informatics solution in COVID-19 pandemic, scoping literature review. All right, the author names of the literature is by the following names. Next, I will pass to Leslie for the presentation. Leslie?
Thank you, Nick. So the abstract of this article, the article indicated that the worldwide pandemic of COVID-19 disease has emphasized the significance of disease surveillance, diagnosis, treatment, and screening. The technology-based instruments or technologies could effectively aid healthcare systems during pandemic by facilitating rapid and broad data sharing, real-time monitoring of information transfer, and virtualizations of meetings and patients' consultations. The study was therefore carried out to assess the applicability of clinical informatics, which we call CI, during the COVID-19 pandemic. Next. In September 2020, the detailed search was carried out on the Medline and Scopus databases. Based on the inclusion and exclusion of the criteria, eligible studies were identified. The data collected from the research studies included information regarding the study sample, study type, objectives, clinical informatics domain, applied methods, sample size, outcomes, findings, and conclusion. The potential for bias in the research was reviewed during methods suitable to each study type. The thematic synthesis was then performed on the selected studies. Next. 72 out of 2,716 collected publications fulfill the inclusion criteria for thorough analysis in this review. China and the United States produced the majority of the review articles. The largest of studies were undertaken in the domains of prediction models, which is 60%, telehealth, 36%, and mobile health, which is the lowest, 4%. The majority of studies in the subject of telehealth employed synchronous methods such as online or telephone or video call consultations. During the COVID-19 pandemic, mobile applications were created as tools for self-triage, self-scheduling, and information distribution. Neural network models, which is 49%, classification models, 42%, and linear models, 4.5%, were the most prevalent types of prediction models found in the examined papers. Next. The article demonstrated clinical informatics applications at COVID-19 and identified existing needs in this sector. It appears that health information technology and clinical informatics can assist physicians and managers in combating COVID-19. Prediction models and telehealth were the most common subjects in the clinical informatics for COVID-19 research. Future scientists were encouraged to perform scoping reviews to characterize and review various layers of medical informatics, such as bioinformatics, imaging informatics, and public health informatics. Next, I will pass to my friend, Farahiyah Dinie.
Okay, thank you, Leslie. So, for the introduction for this research article, China experienced an outbreak of COVID-19 in December 2019, which was caused by severe acute respiratory syndrome coronavirus SARS-CoV-2. On January 30th, 2020, the World Health Organization, WHO, classified the pandemic of COVID-19 to be a public health emergency of global significance. During the first 9 months of the pandemic, there were more than 20 million infected individuals and more than 756,000 deaths globally. So the WHO has concluded that education and social isolation are the most effective preventative efforts, particularly in low and middle income countries. Okay, information technology tools have been found to be potentially effective for teaching patients and providing remote clinical services when applicable. So MI, medical informatics, is a field concerned with the management and utilization of information required in the field of health and biomedicine. MI is a broad phrase that encompasses essential theories, concepts, and approaches for managing and utilizing information in health and biomedicine. CI primarily utilize two types of information, patient-based and knowledge-based. So patient provide information is employed in patient care in healthcare settings, whereas information based on scientific understanding is the foundation of healthcare services. Okay, so medical and biomedical informatics plays a crucial part in COVID-19 pandemic response. CI technique appears beneficial for disseminating disease-related information and controlling patients during the pandemic. A review study offered evidence for several CI applications in clinical setting, including three themes: CI system and intervention for providers, CI system for consumer health, and CI methodologies and recommendations. CI could aid hospital leaders in visualizing medical treatment, making clinical judgment, coordinating communication, and defining workflow and compliance during a pandemic. The widespread adoption of telemedicine to allow patients continue treatment while preserving social distance is one of the most significant shifts in healthcare system. The adoption of patient-specific and population-based forecasting models could result in the scientific classification of patients and the implementation of national and international preventative and control programs. This research aims to identify the CI technologies used in prior studies during the COVID-19 pandemic by conducting a literature review. Consequently, the following goals were pursued. First, collecting published studies on the COVID-19 pandemic using CI. Next, identify the most frequently employed methodologies in published studies. And lastly, identify research gap in pandemic condition. Okay, so next, we moving on with the methods. The Cochrane protocol guidelines was utilized to design the protocol for this systemic review. The 2015 checklist for preferred reporting items for systemic reviews and meta-analysis, the PRISMA protocol, was used to report this protocol for a systematic review. The research team is comprised of healthcare and MI specialists with expertise in research, education, and clinical medical informatics. So first method is the data sources and research strategy. The database Medline and MBAS were thoroughly searched for articles published in 2019-2020. The search was conducted during the second week of September 2020, utilizing a combination of medical informatics and COVID-19 related keywords and the MESH terms. Next, we have the eligibility standards. The following criteria were applied during the selection process for articles, studies that aim to enhance at least one treatment or management outcome during the COVID-19 pandemic, articles pertaining to health information technology or medical informatics intervention. The third standard would be the randomized clinical trials, quasi-experimental studies, and observational research. Fourth, research that published in English, studies released in scientific journals, and studies published during 2019 until 2020. So the following criteria determine the exclusion. So the articles whose title, abstract, or full text did not pertain to COVID-19, thesis, book chapters, letters to editors, editorial, short brief reviews, or meta-analysis, case study, conference paper, and study protocol. Articles for which the full text was unavailable, and studies on contact tracing tools. Next, we have the article screening and data extraction. After conducting a database search, papers were selected separately by 2 reviewers based on the examination of their titles and abstract, and studies were subjected to full text evaluation to determine their eligibility. Using a pre-specified data collection form, 2 viewers independently retrieved the necessary information from the eligible publication. To assure the correctness and completeness of the data extraction procedure, a third reviewer examined the extracted information. The data retrieved from the examined research concerned the study sample, study type, objective, clinical informatics domain, applied method, sample size, result finding, and conclusion. So coming up next is the risk of bias. Using the STROP instrument, locality of observational publication was assessed. A higher score in this assessment indicates a decreased chance of bias. Using the prediction model risk of bias assessment tool, which rate the applicability and risk of bias in diagnostic and prognostic research, the quality of prediction studies was evaluated. Utilizing the quality assessment tool created by Brown based on the research of Estrabut et al., the pre-post intervention study design and quality of quasi-experimental studies was assessed. To conclude, the Cochrane collaboration instrument was used to evaluate the risk of bias in clinical studies. The last method would be the synthesis and analysis. In the study, 26 examined research was undertaken in the domain of telehealth. So 24 research utilized synchronous methods such as internet, phone, or video call consultation, whereas 2 study utilized asynchronous approach for communication and delivering telehealth service. Okay, the 30% from the 26 research used online consultation. Video communication was deemed the optimal method for patient-provider engagement in the assessed research. 6 studies utilize video conferencing technology for communication purpose, while 8 study utilize the telephone as a telehealth technology. Lastly, 1 study utilized a Bluetooth-based real-time telemetry system to assess vital signs in isolation ward. The study demonstrates that telemetry systems are significantly safe and dependable in minimizing the risk of nosocomial infection and the workload of medical staff. 2 of the 26 research undertaken in the telehealth area utilize asynchronous communication to deliver telehealth services by deploying an automated text-based activity monitoring system and transmitting photograph respectively. Those studies demonstrate that teleconsultation can increase patient compliance and doctor-patient communication. So 3 of the review study established and developed mobile health system. Two other studies use a mobile platform to disseminate COVID-19 information and a psychological health digital learning package to train all healthcare personnel respectively. With that, I end my presentation and pass the floor back to Leslie to present the next point. Thank you.
Thank you, Dinie. So I will be presenting the results. So in the article review, it analyzed the analysis based on the Medline and Embase database provided a total of 1,882 and 1,045 articles respectively. After deleting the duplicates, there remain as 2,716 articles. On the basis of the titles and abstracts, there were 110 papers were selected for full text review. Following the full text examinations, 38 publications were removed as irrelevant, leaving 72 papers for qualitative synthesis. The included studies were described as, regarding the study design, the evaluated papers were diverse. 72 papers were reviewed, 57 were cross-sectional, 12 were cohort, 1 was case control, 1 was before and after, and 1 was a randomized control trial, which is RCT. The study revealed that 19 investigations were undertaken in China, 17 studies in the United States, 6 studies in Italy, 5 studies in the United Kingdom, and 4 studies in India. The risk of bias assessment is the STROP checklists were used to assess the reporting quality of 27 analytical observational studies of the study. Introduction and methodology parts received the greatest and lowest evaluations respectively. In addition, 27%, which is at 10 cases, of the research failed to identify their funding sources, giving in an average reporting quality score of 0.73, which is 0.4%, of the majority studies, which is 33, did not provide a bias determination. These were explained in item 9. The overall quality score for the discussion segment was 3.3, which is 0.70. In addition, 31, which is 83.8% of the studies received an intermediate quality rating. Robust indicated that the risk of bias in other studies was low. A RCT was designed for 1 study. Overall, the study received a high quality score. This review only contained a single quasi-experimental study which had a low quality score overall. Next. Medical informatics domain. In the study, 26 of the examined research were undertaken in the domain of telehealth. 24 research utilized synchronous methods such as internet and phone or video call consultations, whereas 2 studies utilized asynchronous approaches for communication and delivering telehealth services. In addition, 9, which is 35% of the research, used online consultations. Video communication was deemed in the optional method of patient-provider engagement in the assessed research. Additionally, 6, which is 24% of the studies, utilized video conferencing technologies for communication purposes. 8, which is 30% of the analyzed studies, utilized the telephone as a telehealth technology. And finally, 1, which is 30% study, utilized a Bluetooth-based real-time telemetry system to access vital signs in isolation wards. The study demonstrated that telemetry systems are significantly safe and dependable in minimizing the risk of nosocomial infections and the workload of medical staff. 2, which is 6% of the 26 researchers undertaken in telehealth area, utilized asynchronous communications to deliver telehealth services by deploying an automated text-based active monitoring system and transmitting photographs, respectively. Those studies has demonstrated that teleconsultation can increase patient compliance and doctor-patient communication. 3, which is 3.5% of the review studies established and developed mobile health system. The other 2 studies use a mobile platform to disseminate COVID-19 information and a psychological health digital learning package to train all healthcare personnel respectively. In Figure 1, showing the distributions of the review study based on the country. And the Figure 2, showing the distribution of the study based on medical informatics domains. Next, I will pass to my friend Nicholas.
Thank you, Dinie. Thank you, Leslie and Dinie. So this is the discussions or the part where the researcher has discussed and we have reviewed it. The review of the study demonstrated the application of CI during the COVID-19 epidemic and reveal current shortcomings in this field. Numerous research have demonstrated the use of clinical informatics in the diagnosis, treatment, and management of COVID-19. Third, the literature research for published scientific publications allowed us to obtain 72 studies pertinent to this topic. It was discovered that many CI domains have the potential to aid in the management and control of the current COVID-19 epidemic. Models or predictions were the most useful field of study for this unprecedented global pandemic to minimize the repercussions of an epidemic. It is essential to efficiently control the epidemic in its early phases of emergence and to prevent its spread to other nations in order to save a large number of lives. In addition, reliable prediction and monitoring of the illness transmissions pattern could help officials create and implement the necessary control initiative. The teleconsultations could play a crucial role in preventing and controlling infection by creating social distance. During the COVID-19 pandemic, the use of telehealth has increased and expanded to reduce the risk of the disease transfer by increasing social distance and reducing direct contact. It helps providers use limited supplies for the most urgent case. mHealth is one of the most appropriate methods that could be used to manage COVID-19 by providing health services through televisit instead of patient-physician direct contact. Due to the advantages of using smart mobiles, such as cost effectiveness, simplicity, availability, and accessibility, the use of mHealth is recommended for information exchange. Clinical decision support systems have become more popular among healthcare providers and clinical researchers. None of the included articles evaluated the use of CDSS for COVID-19. Data gathered could be useful for possible outbreaks that may occur in the future. Results from previous pandemics are useful for confronting the recent pandemic. Many of the review studies had no risk of bias. The quality of methodology section varied significantly among the included studies. Limited information on study design, main results, statistical analysis, and interpretation was the most important factor contributing to the low scores of observational studies. Only 25 studies obtained good quality scores in the methodology sections. Finally, in summary, the study demonstrated that clinical informatics applications were utilized during COVID-19 and indicated existing shortcomings in this field. We as the students also learned from the study that it appears the health information technology and clinical informatics can help physicians and managers battle COVID-19. Prediction models and telemedicines were the most popular domains in clinical informatics for research on the COVID-19 pandemic. Finally, the study also recommended that future researchers conduct scoping studies to describe and examine others players of medical informatics, such as bioinformatics, emerging informatics, and public health informatics. With that, I conclude our presentations today. Here are all the references being cited, and I thank you everyone, and thank you Dr. Zul for listening in. Thank you.